the timer.
We're going to talk today about network meta-analysis with Darko Medin, our guest at LARVOL Onco Data, your weekly podcast with me, Bruno Larvol, and a guest from often all over the world, an expert in cancer, an expert in data, and today a noted biostatistician based in Montenegro. And LARVOL has worked with him for a long time, and Darko has been an excellent partner of ours. And the benefit of our company is that we can hire the very best talent all over the world. Darko is a wonderful, very friendly, very clear patient also at explaining to me and today, maybe to a broader audience, some of the important concepts of biostat. So, Darko, welcome to the podcast. Bonjour.
Thank you so much, Bruno, for such a fantastic introduction. Bonjour, and it's really great to join you and discuss some very important topics for our audience.
Before you start, can you say a sentence or two about your experience? And just to be a little cheeky, why should people listen to you? So brag a little bit about your great experience and background, if you don't mind, in a way that if your mom is listening, and I'm sure she does, she would say, oh, Darko is not too modest today. Brag a little bit about your great background, please.
Oh, thank you so much for that, Bruno. Well said. Okay, I will try. So I'm a biostatistician, as Bruno said, working with different companies around the world. I had the pleasure to work with LARVOL too, and I must say it's one of the top companies that I had the chance to collaborate with. I also collaborate with a lot of researchers, with academic institutions, and I'm someone who is at this intersection between biostatistics, clinical research, and data science. One of my areas where a lot of my work has been done is oncology, and that's why I'm glad that we're discussing specifically this topic. And we will be discussing some very important aspects of why oncology data is very specific, why meta-analysis in this area is also very specific, and focus on some very interesting aspects for our audience. And hopefully the audience will get some very valuable information about this area, about this whole intersection of oncology, biostatistics, data science, maybe mention machine learning and some similar areas.
Yeah, we will actually keep machine learning and AI for another podcast, because otherwise it's going to take all the time. We only have 15 minutes, or actually 10 minutes. It's going to be very concentrated on today. By the way, side note, there's a little bit of background noise. So you might want to keep your hand out of your desk. It resonates a little bit with the podcast. No problem, but some of these microphones are very sensitive. So here's my first question for you. And assume that the audience knows a little bit about, data and data science and biostat, but not too much. Some of them might know a lot, some of them not at all. Can you first differentiate between systematic review, meta-analysis, and network meta-analysis? And then we'll focus exclusively on network meta-analysis. But if you could differentiate the three things first for us.
Well, I think that's a fantastic question, Bruno, because these three terms are used interchangeably in oncology, and it's very important for people to understand the difference between them. They're very similar. Sometimes they go together in research, but they're still different. So if we talk about systematic reviews, the systematic reviews are generally focused around reviewing the literature. So we don't really need to include statistical analysis as long as the review of the literature in terms of the clinical review, in terms of the scientific review, in terms of the theoretical review is there. Now, if we want to go a step further, we can add the analysis part. For example, we can take 10 studies or 20 studies and utilize statistical analysis to summarize the results, to create an overall result, to combine all those studies using statistics. And that would be the meta-analysis approach. Now, if we want to go even another step further, we can lift the scale to another level, which is network meta-analysis. We can summarize and compare a lot of different treatments, so not just one treatment, a lot of different treatments in specific oncology field, and create network of those treatments. So we can compare them to each other, we can compare them directly, we can compare them indirectly. And this indirect comparison is one of the reasons why I said we are bringing another level to the meta-analysis, because the standard meta-analysis approach does not have this indirect comparison um, included in such way. So that would be a very brief explanation of what you said. Of course, you and I discussed this a lot, and this is one of the most important fields of biostatistics in oncology today. And thank you again for asking that question. I think that it's very important for our audience to get introduced into these three levels of analysis.
So let me try to describe as if I was talking to my mom, let's say, okay, the difference between these three. Let's test my understanding. So, a systematic review is to compare papers, studies, to say these are relevant to a certain, let's say, tumor type, let's say prostate cancer, or let's say non-small cell lung cancer, or metastatic non-small cell lung cancer. Okay. And these studies are relevant, and I'm going to compare them and compare their results. Maybe I'm going to compare them in a tabular fashion. That would be a systematic review, arguably. A meta analysis is when I extract as much of the data as possible from each of them to compare each of the, let's say, 5 studies that we want to compare. And I do that, if I recall, with something which is poetically called a forest plot that show the hazard ratio of each. We can maybe in a moment describe even what it is, perhaps. But that's a meta-analysis. Now, a network meta-analysis is when we indirectly compare products, right? So let's say we have a study that compares product A and B, and there's a study B and C. The meta-analysis through the network meta-analysis can navigate that network and compare A and C. Am I correct in that description?
You're 100% correct. So that's even a better explanation of what we were discussing. So the network meta-analysis allows for inferring the results that we cannot infer in a typical meta-analysis. So as you explained in a fantastic way, if we have two direct comparisons, so A versus B and B versus C, we can infer A versus C. So that's the comparison that was not there initially. It was not directly done in the studies, but through network analysis, we can indirectly infer that comparison. What does that mean? It means that we can use network meta-analysis to infer many results that were not directly performed in the studies. In addition to that, as you mentioned, network meta-analysis allows for comparing many different treatments simultaneously. This means that the scale of comparison is such that it allows companies, researchers, institutions to compare a lot of different treatments and to see which of those treatments perform better, which of those treatments are safer, and another very important aspect, bring the scale of the comparisons to a higher level.
So my mom is just texting me, and she's saying, "Hey, Bruno, ask Darko, ask Darko, what is a hazard ratio?" I don't know why she wants to know that, but ask Darko what is a hazard ratio and how does hazard ratio play a role in meta-analysis and maybe network meta-analysis. My mom used to be a math teacher, but that was a long time ago. So she might need a very simple explanation.
That's another fantastic question, Bruno, and it's a great continuation from where we stopped in the discussion. So hazard ratios, uh, the simplest form of explanation for our audience would be that hazard ratios can tell us how effective is a specific treatment. For every treatment, we can have a hazard ratio, and very simple, if this hazard ratio is smaller than 1, then we have a beneficial effect for the treatment. There are exceptions, but this is generally how we see it. And if that hazard ratio is above 1, then we have a negative treatment. So hazard ratio is a very simple metric. We also call it the relative risk, because if the hazard ratio is beneficial below 1, that means that we have a risk reduction for that specific disease. That means the therapy is actually working, and vice versa. So hazard ratio is a very simple metric to describe if a therapy reduces the risk or not. And in network meta-analysis specifically, we can have a hazard ratio for every comparison. For treatment A versus treatment B, for treatment A versus treatment D versus treatment C, F, G. So for every direct and indirect comparison, we can have a specific hazard ratio and present that either on a network or on the forest plot and infer many different results simultaneously.
Um, what's the meaning of the word time to event analysis
That's
of
that's
data?
another very important topic, because hazard ratios are actually related to this. Most clinical research in oncology field is done in a specific biostatistics area, which is called survival analysis. And survival analysis is all about observing what happens in relation to time, in relation to different follow-ups and different time points. So these different follow-ups and time points are used to create what is called, as you mentioned, time to event data. We observe what's happening with the events, such as mortality or adverse events, in relation to time. So we don't have just one snapshot of analysis, we have many snapshots in many follow-ups. And in such analysis, in survival analysis, the time-related analysis, we can calculate the hazard ratios. So all these terms that you brilliantly asked are actually related. So hazard ratios, they are a product of survival analysis, and we can use these hazard ratios to perform either meta-analysis or network meta-analysis.
Uh, Time flies when we're talking about biostat. Go. we will need actually to close today's podcast. So I just want to thank you for participating to LARVOL Onco Data, and I hope we'll see you another time. Thank you very much, Darko. Au revoir.
Thank you so much, Bruno. I think it was a fantastic podcast, and it's really a pleasure always to join you.
Thank you.